Hi, this is Dallas. I'm reporting on intellectual disability, environmental and cultural factors. So to start with the summary of health concerns from my last presentation, people with intellectual disability have a limited ability to learn that impacts their daily function. There's 65 million people in the United States that have an intellectual disability. Common communicable diseases among people with ID are infection control problems, STIs, and education-related STIs are important among this population. Non-communicable diseases that are common include seizure disorders and mental illness. There are risks of self-care deficit among people with intellectual disabilities, as well as neglect, and this population is also at a high risk for sexual abuse. As far as social determinants of health, some barriers to this population include economic stability, healthcare access and quality, and I've said that a modified approach to education access and quality is to be considered because special education is one way to approach helping this population to have access to quality education. So intellectual disabilities in the media. This can serve as a barrier by reinforcing stereotypes. An example of stereotypes that have to do with this population are innocence or naivety. There is an underrepresentation of people with intellectual disability inside of the media, especially by actors that have intellectual disability. So you don't see a lot of actors from this population that are representing their group. So the media does have the capacity to patronize, victimize, or demonize people with intellectual disabilities. I found it interesting that Canada's Centre for Digital and Media Literacy actually uses these three criteria. They request anybody making film or media ask themselves whether they are doing any of these three things. And if they are, they should reconsider how they're portraying people with intellectual disability. So, family support inside the cultural environment. So I've just broken down the social determinants of health in Maslow's hierarchy of needs because I think that family support can greatly influence these. So, for example, a person with intellectual disability might need rights to appointments, or they might need someone to pay for their appointments or doctor's visits. They sometimes need help finding a good job. Family can also influence a lot of how education is handled, whether they receive a quality education, and what route they decide to go with that. Do they try to go through usual education systems? Do they do special ed or private education? Family is also a big part of the social community context, including how an individual builds their identity and how they build their self-esteem. It's really important to have family support early on in life, and if not, it can greatly affect how a person meets their needs. So if they're not met with meeting their physiological and safety needs at an early age, it's much harder to reach self-actualization. So role of peers. They can be either supportive or destructive. Once again, peers can have a large influence. Being part of that social circle, they can help with those social determinants of health. Or they can be a roadblock in that regard. So supportive peers might befriend someone with intellectual disability, help them, or allow them to help them as well, treat them like, in other words, treating them like another peer or as quote-unquote a normal person. rather than, belittling them or talking down to them. Obviously, destructive behavior, bullying is very common, especially among children. Can be really cruel to one another, especially to people that have intellectual disabilities. So this can be a big deal, especially at a young age. So cyclical nature and cultural environment. So I've just posted here a picture of genetic factors as they relate to intellectual disability. This is actually really complicated because the etiology of intellectual disability is various. So there's lots of different ways to be put into intellectual disability, because really the classification just has to do with IQ scoring. Some of these are very clearly genetic causes, things like chromosomal aberration. There's single gene, metabolic and epigenetic changes, X-linked gene issues, autosomal recessive traits, autosomal dominant traits that are, very clearly genetic in nature. There's also non-genetic causes like alcoholic syndrome, and there's environmental causes, infection, injury, exposure to certain chemicals. And then there's causes that aren't as clearly genetically linked. So there's some research that says that, ID does not run in families, or that it's not hereditary, but it also can run in families. So it's pretty complex and convoluted kind of nature as far as heredity is concerned. So within the legal and political system, the most significant thing to talk about here would probably be the Americans with Disabilities Act. Now this applies to all disabilities, not just intellectual disabilities, but it's important, I think, in this context to consider. So it addresses, there's 5 titles, and they address employment, state and local government, public accommodations, telecommunications, and then there's other provisions as well. So employers must provide reasonable accommodations. Discrimination is prohibited in any state or local government programs. Private places of public accommodation cannot discriminate against individuals with disabilities. Sorry. The Act also requires telephone and internet companies to provide communications that allow people with hearing and speech disabilities to understand. And then there's also provisions that have to do with other laws, as well as insurance, and there's a list of conditions that are not considered disabilities within there as well. So potential barriers inside of the cultural environment. One that I can think of is intellectual elitism. Society tends to hold people up that are considered to be, intellectual, or people who are considered to be smart. And it's also common for people who are perceived to be less intelligent to be mocked. We see the changing of certain terms have changed over time to be derogatory. A lot of terms that were connected before with people with intellectual disability, and we've seen that change over time. So multiple times there's been different words to describe them, and they have continued to change. We've seen, most recently the notable one is that mental retardation is not used commonly to describe people with intellectual disability because of the way that it's become pejorative. And that applies to other words that were used previously as well. Also, barriers can include stereotyping. People within this population may be expected to act a certain way or work certain jobs. And then, of course, bullying is, or mocking can be, or use of these pejorative language can harm this population. Moving on to international scope. So 1 to 3% of the world population is considered to have an intellectual disability, and this is greater in developing countries. So the Global South and countries that are still developing considered to have greater population of people with intellectual disability, greater incidence. They also have young populations, so it may continue to be an issue if they don't have sort of social infrastructure to help people within this population. That could grow to be an issue. Socioeconomic status. So this, it's common for people with ID to be in low socioeconomic status. This can cause, lack of insurance, inability to pay for visits, or to pay for prescriptions, which, of course, can be a detriment to their health. In regards to race and ethnicity, I once again have listed social determinants of health because I think that they relate to these issues. So similarly, anyone, of minorities, minority race or ethnicity within the population of intellectual disability, I think it applies in a similar way. Specifically within this population, I don't consider any major differences. Anybody within this population who belong to a minority group are still going to see the same sort of implications as any other person with minority status. So, religion in the context of intellectual disability. Once again, I've sort of listed some things generally that have to do with religion because I don't think that intellectual disability changes those implications a lot. So there may be traditional healing practices depending on what sort of religion a person is a part of. Certain ceremonies may have to do with healing. These could either help or hinder health, depending on what they are. As far as adherence to rules or certain commandments in religions, certain practices prohibit, certain religions prohibit different practices within healthcare, and that may be a detriment to health. And then, of course, religious discrimination is always a possibility if someone is part of a religious minority. Gender disparities. So men are more likely to have intellectual disability than women are, which is something interesting to note. But then besides that, there's, your typical gender bias or stereotypes that anybody within this population are not immune to, of course. So people with intellectual disability tend to live in rural areas, or ID is higher in rural areas, and this means that it can be more difficult to access healthcare. Hospitals are usually located farther away. Emergency care can be an issue if they can't get there quick enough, as well as they may not be as likely to visit the doctor, visit the hospital when it's farther away. Telehealth can resolve these issues. One is video visits, with doctors. Anything that you don't need to see the doctor in person for, this is a great way to address it. And then also phone apps can help to address this. So there's apps for improving brain health, diet and exercise, diabetes management, planning dental visits or doctor visits. All of these can be helpful. Bias, both implicit and explicit bias. Implicit biases might include, certain assumptions and stereotyping. People may tend to treat members of the population of intellectual disability differently without realizing they're doing so. That's something to consider. Explicit bias, obviously discrimination or hate speech, using pejoratives. All of that can certainly harm people within this population. International scope. So limited healthcare access in the global south or developing countries. There's also an elevated risk of violence and poverty in these countries. And there's a possibility of lack of legislation and, globally for people with intellectual disability or disability in general. The American Disabilities Act did not go into place until 1990, which is not that long ago. So it took a long time here. It's, that's may still be developing in other countries as well. Here's my references, the first page and the second page.